Sisters of Providence Health System STAR program. It stands for Survivorship Training and Rehabilitation. It's focused on helping cancer survivors heal physically, emotionally, and spiritually. So joining us to share more, we have Dr. Philip GLYNN and Jill LEGATES. Thank you so much for joining us today. You have an intriguing, unique program, very progressive. It's called Cancer Rehabilitation. Tell us a little bit about what cancer rehab actually is.
When a patient has gone through cancer therapy, commonly there are sequelae, whether it's fatigue or whether it's some pain syndrome. Sometimes it might be a neuropathy or a cognitive impairment. That they need to get therapies and treatments the same way you would from if you had been in some kind of traumatic injury or if you had had a stroke. And this is focusing on that to try and improve somebody's quality of life and overall functional state.
It's almost like when you break your leg, you go to physical rehab so that you can come back to 100%. So what you're doing is taking this cancer rehab program and taking people who've already been treated and who feel fantastic, you're getting them back to normal and oftentimes making them feel even better.
It allows the physical therapists, occupational therapists, and speech therapists to work with the cancer patient after before or after they've been through their cancer treatments to help them keep that quality of life, whether it's pain, whether it's fatigue, whether it's a musculoskeletal or swallowing issue. Allow them to treat those signs and symptoms for a better quality of life and allow them to continue to do the functional activities that they want to do in their daily life during this process.
So this is all part of the STAR program. This is something that's unique here to Western Massachusetts. So you help improve patients. So what kind of disciplines do you offer? I know we just talked about it, but let's get into it a little bit. What do you offer for people once they've had their successful surgery and everything's in remission?
With the STAR program, what is unique about the STAR program is that we had about 50 staff at Mercy Medical Center go through an online training and competency program to understand all about cancer, what cancer is about, the treatments for cancer, and then how as rehabilitation professionals we can work with those patients with whatever signs or symptoms they have, either from the cancer treatments or aftermath of the cancer treatments, or even before the cancer treatment, so that they're prepared for their cancer treatment. So there's physical therapy, occupational therapy, and speech therapy, and depending on if it's a musculoskeletal, if it's pain, if it's fatigue, sometimes with head and neck cancers there can be swallowing dysfunction with a patient. There's also something called lymphedema. It's edema that may come from different types of affecting the lymph in the system, that we have specially trained therapists that can work with that.
And these therapists, there are more than 50 of them. I know, Dr. GLYNN, you were one. Everybody passed with flying colors, which I think goes to show that people are invested in this program taking off because it can really help going forward. As you say, what types of cancer are able to be treated by this rehabilitation?
So there's a wide range of cancers, and it's actually perhaps more a function of what the individual patient's needs are. And so an important component of this might be a patient who may have lymphoma or leukemia, needs some strengthening before they're going to go to transplant. In that case, they're actually getting a prehab because they're getting rehabilitated before they go into something that might be even more challenging, so that they're in better shape to be able to tolerate it. People can get this kind of treatment during the course of their therapy so they can get through it better. And then, of course, people can get treatment after they're done. So it's a function of what the individual patient's needs are and what their assessment is at the diagnosis, during, and even after treatment. It's really a continuum of care.
A lot of people are apprehensive about physical therapy because they don't think it will help them, but I can imagine that the doctors and the team sits down with people and talks about the options available and how they'll work.
Yeah, and we had talked about this a little bit before, that a big part of this is to help people see that if they are in the midst or they're through the therapy, that their quality of life in some instances may improve, and they're going to be perhaps even more committed to a healthy lifestyle, to have a better functional level of activity. So it is something that it's a service that a really wide range of patients are going to benefit from, and I think the more people we treat, the more people we'll see we'll see that benefit's there.
I think that's a unique advantage, I'm sorry to interrupt, of this system, that sometimes when people beat cancer, which is something that's seemingly insurmountable at times, once you beat that, you feel like you're on top of the world and you can do everything. So we were talking earlier about a new normal, and that's what the rehabilitation program can provide.
It allows our therapists the opportunity, after the physicians have identified that the patients are identifying that they're having some challenges still in their life, that they can take those pieces and find out what is going on. Is it fatigue? How do we manage that? How do we get you back the strength and the energy to do what you need to do? How do we control your pain? How do we work with your musculoskeletal weakness to get you stronger so you don't have to live with those signs and symptoms? You can take that challenge of successfully beating cancer and moving on into another step of life by getting the tools that you need to manage those.
It's a great point. It's one thing to beat cancer, but it's another thing to come out better on the other side after having the diagnosis and the help. Thank you so much for stopping by today.
Great.
Pleasure chatting with you, and this is covered by most insurances. We should cover too.
Yes, most insurances have a rehabilitation benefit that would cover therapy services, so it's important for people to know what insurance they have and what coverage they have for therapy services.
Thank you so much. There you are, and if you want to make an appointment, you can call 413-748-6880, or for more information, you can just visit mercycares.com.